Welcome to www.medicalcontentsolutions.com's presentation of the Essential Cardiac Care series. Once again, my name is Jack Blankenship. I'm an RN with Medical Content Solutions, and I'll be your host. As always, consult your physician. This is not intended as medical advice, and every effort has been made to ensure the accuracy of this information as it is based on today's medically accepted standards of care, and this is for informational purposes only. The focus of this series today is on primary portal hypertension. Follow this video to learn more about primary portal hypertension. And are you ready? Great. Let's get started. So what is primary pulmonary hypertension? Primary pulmonary hypertension is defined as abnormally high blood pressure in the arteries of the lungs, or just high pressure actually. What does the primary mean in primary pulmonary hypertension, you might ask? Well, the primary refers to the idea that you do not have any other cardiac or respiratory problems. So, essentially it means that the doctor does not have to focus on other disease-based causes for the high blood pressure. Hence, that's the reason why it's called primary. Okay, so what does the pulmonary mean in primary pulmonary hypertension, you might ask? Well, pulmonary refers to your lungs. The abnormally high blood pressure is found in the arteries of your lungs. That's where it's located. And because of the location of this hypertension, it is called pulmonary. This leads us to another question. How many people are affected by this disease and what causes it? Well, the good news is that this condition is fairly rare. It does affect women more often than men, unfortunately. And also, unfortunately, little is known about the underlying cause of PPH. It is thought to be genetic based, however. So what is the big deal about this problem, you might ask? The big deal is that as a result of the increased pressure in your lungs, the heart has to work harder to pump blood. This affects the right side of the heart, causing the affected area to enlarge. And if you recall in our prior series, that's not a good thing. Eventually weakening the heart muscle. This weakening leads to heart failure. So you can see just how PPH is a progressive disease that not only affects the lungs, but also causes cardiac complications as well. I was wondering, what are some of the symptoms of primary pulmonary hypertension, you might ask? Well, here are some of the symptoms that you may experience if you have PPH. Shortness of breath during activity, weakness, fatigue, dizziness, swelling of the legs, or edema is the more common medical term. Are there any tests that the doctors can do that will detect primary pulmonary hypertension, you might ask again? Well, yes, there are. And some of these tests are physical exam. Your doctor may notice enlarged veins in your neck during a physical exam. This is one of the symptoms or the signs. Perhaps an enlarged liver and heart murmur may be detected, as well as edema or swelling in the legs. All these things go together. The problems that happen with the weakening of the right side of the heart, you retain fluid, you can hear it. Your lung sounds may be normal, but you're going to have an enlarged liver and also a heart murmur because your heart is working overtime and now has developed a murmur. It's weak. Your doctor may order some of the following tests as well: a chest x-ray, ECG or electrocardiogram, or EKG is what most people know it by, pulmonary function test, nuclear lung scan, CT scan of the chest, and more tests that may be ordered as well are cardiac catheterization and pulmonary arteriogram. Now, this leads you to another question, which could be, what if I find out that I have PPH? It can be treated, right? First, the bad news. There's no known cure for PPH. But, thankfully, there are treatments available in combating this disease. And that's really good news. So, what are some of the treatments available, you might be asking right now? Overall, your doctor's goal is controlling your symptoms, so it's really symptom based, and this is done in a variety of ways. And of course, again, this is where medications play an integral role in decreasing or controlling your symptoms of PPH. And these medications are calcium channel blockers, and diuretics. If you recall, in the first series, we did discuss those at least on a limited basis, because again, just discussing each and every medication in detail could entail a whole series, and will eventually a whole series of videos on the subject. We'll keep it light for today's purposes. Also, many patients respond favorably to the usage of these oral medications, again the calcium channel blockers and diuretics. However, some require the use of intravenous or IV versions of medications to treat PPH. One such intravenous medication is called intravenous epoprostenol. That's an example of one such drug. Again, another mouthful. Very difficult to say the word. The name for the medication itself. I'm sure a lot of doctors have the same difficulty. Also, in the progression of the disease, oxygen may be ordered. And again, remember, this is a pulmonary or lung disorder as well. So if you can't breathe, you're not getting the oxygen in your lungs like you really need, or in your system, then you're going to need some oxygen replacement or supplement. Also, in very bad cases, heart and lung transplants may be necessary. In some very serious cases. Again, this is something that's not normal, but if the disease has progressed to such a state that the outcome doesn't look good, then that may be something the physician is considering. So what does this all mean for me? Well, early detection of this disease is vital in providing early treatment of primary pulmonary hypertension. This early treatment can vastly increase your chances for improving your overall quality of life. And again, this is key. This is a progressive disease. There's no known cure. And so what you're trying to do is treat the symptoms and decrease the symptoms, so that you're not only do you hopefully extend lifespan, but you also extend the number of days that are fruitful and that are really full of good quality of life for the patient. If you think you or a loved one have any of the symptoms of PPH, then you must consult your physician or 911 immediately. We hope that you've enjoyed this instructional series on primary pulmonary hypertension and have found it both entertaining and informative. It is a little shorter than the other videos, only because this, again, unfortunately, this disease does not have a whole lot of treatment options. There are a lot of things that they're working on right now. However, I have highlighted the basic ones that are being used today by today's cardiologists and pulmonologists. We do look forward to seeing you and joining us again in our future cardiac series productions. And as always, this is not intended as a substitute for your own physician's medical advice. Remember, nothing you ever see or read is. Please consult your physician for medical advice. And once again, thank you for joining us today.